So this is a female cockatiel. She is, how old she is?
She's 3 years.
She is 3 years, and she has laid second time eggs. It's second or third? This is third time.
Yes.
In how many months?
I think within a year.
Within a year. No, just in recent.
Within 2
In 2 months, she laid three
Third.
time eggs, and this should not happen. Okay, if the bird lays, keeps on laying egg, that's called, then birds may suffer with egg binding, and that turns into chronic egg-laying disease also, because they want to have more families, they have nothing to do. Okay, so she has egg binding, come close. She has difficulty in laying egg, the third egg. So I'm just assuming this is because this happens generally because of calcium deficiency, and if there is a soft shell issue or there is a oversized egg, if egg is too big, they won't be able to. So she was bleeding from her vent, because vessels will start getting damaged, because if she is trying to push that egg, expel that egg, vessels will break. So the bird was bleeding inside the nest box last night. You can see there is still blood here. Yes. Yeah. I can't see it. There are the eggs. The third egg she has difficulty in laying. So if you guys have any bird who has an egg laying issue, you can do is just switch on that. It's on.
So it's on.
We have to give a steam therapy, so that abdomen, that part, that area will absorb. Yes, come baby. Yes, that heat. Okay, and this heat, this steam, actually we are using the steamer to give us steam. So the technique I'm using to hold this bird, if you are very much confident in holding the bird, so that you can hold the bird like this, and on this bottom part or a belly area, this vent area, this abdomen area, you just don't take her too close because it starts burning. See that? So hold her like this. So 2 minutes you're gonna give her steam like this, abdomen steam. Then take a nice video of the steam also. Okay. Yes. Then give a break. Then 2 minutes and give a break. Do it for 4 to 5 times. That's total 10 minutes. Then break. In a day, 4 to 5 times you have to do this. So this steam bath will help in expelling this egg. She will be able to lay the eggs. This is the male. See, he's not biting.
This is the male.
He knows me, and he bites everyone.
Yes, he bites.
When they have babies, they become very much territorial, and he's coming here to check out what's happened. He knows everything. She's going through egg laying problem. Yeah, this is egg binding patient. Okay, so if you don't know how to hold this bird, hold any patient when they have an egg laying issue, just simply aim that steam on her belly part. So make sure it doesn't go direct on the face. You see this? I'm just moving. I know this steam is gonna go on this part or this belly area. Okay, this is another technique, and you have to do is another thing. You're gonna take oil. It should be olive oil or coconut oil. I'm gonna take this oil like this. I'm gonna part the feathers like this. I'm gonna rub on this belly. It's for lubricating. Okay, the skin is gonna absorb. It will coat the intestine. It will absorb, and it will help her in pushing out the egg. See this? You can see this? Yeah, because of the egg, even stool is stuck inside. See this? You have to rub it like this in a day 4 to 5 times. So just explain, ma'am. Can you please describe what happened? How did you come to know she has difficulty in laying eggs?
So she was normal like that, but when she woke up a day back, she stopped all her activities like eating or interacting with her babies. Usually she does come out and interact with her partner and the small babies, but she stopped doing, and all of a sudden she also stopped moving completely. No intake of water,
Yes.
food, seeds, nothing.
Okay.
And then I had to
And you
contact
could see
you.
some neurological symptoms. She was
Yes.
unable to stand and she was unable to walk. She was
Yes.
shivering
Yes.
and she was not able to walk
Yeah.
on a stand. So you called me yesterday. I gave some medicines. She
After
felt
which
better.
she was better.
And in midnight, when she was trying to expel the egg, she was
Yes, she started bleeding.
displaying that
Yeah.
displaying neurological symptoms, and she started bleeding.
Yeah.
But still, she hasn't laid egg. But with the treatment, with my treatment, the bird has actually survived.
Now she's active.
She is active. She is
Yeah.
able to walk. She is standing on her feet. She is bobbing her tails. That means she is trying to push out that egg also.
Yesterday, when she was trying to stand on her feet, she was falling down and her eyes were continuously closed.
Okay, so we're gonna keep her on this steam therapy for until she lays eggs. Actually, 2 to 3 days. Surgical removal option should be the last option because after giving anesthesia, the bird may come back to life or not. There is no guarantee the bird will be alive or not. So it's better. Let's give a chance. There's home remedies. With the home remedies, with the steam, and with rubbing that oil
Oil
externally
on the belly.
and giving oral doses of good amount of calcium.
Yes.
If you give overdose of calcium, the bird will go.
Oh,
Yeah, overdosing calcium is very dangerous. So you have to know the dosing as well. So thank you so much for giving me a chance, and she needs a lot of rest. In that water, you're gonna put calcium, glucose, vitamin, and make sure she eats. If she doesn't eat on her own, you're gonna give that vitamin drops orally, and also you're gonna give her electrolytes orally. Just keep her hydrated. She's actually dehydrated, and you have to rehydrate.
okay.
So injection I have given, which has vitamin, calcium. If she doesn't eat, it's okay, but she has to drink water.
Okay.
If she stays dehydrated, she's gonna have difficulty in laying eggs. Come, what's her name?
Jan.
Jan.
Jan. So Jan is looking much better. Okay. I'm gonna leave her back inside her cage. Yes. She was and a very yes, very good male and female parent cockatiels. They still allow their babies to come inside. See, the father has come out. He attacks everyone.
Yes. Especially when you get near the nest.